I'm with the Center for Community Health Evaluation at Group Health Research Institute. We've been part of Group Health for 25 years, and we came together, three of us, as part of a research study that was focused on community health promotion. And we went on after that to work on another initiative that was focused more on the same issues, community health promotion, but we decided to change the methodology to be more community friendly, to focus more on less scientific, more on the aspects such as the coalition functioning and the dynamics of the coalition. We serve as evaluation partners for community efforts that are working to improve community health. And we see ourselves more as partners than as outside evaluators who come in with an independent perspective. We're part of the team and we try to work to make it successful. And part of that is telling the story of the initiative, part of that is documenting the outcomes, and part of it is working to improve as well as prove the initiative results.
We work collaboratively with our partners to design the evaluation and to bring an evaluation perspective to their work, from planning all the way through the end and measuring impact of their investment and feeding information throughout the program, throughout implementation, so mid-course corrections can be made. Right now we have about 40 projects working with about 20 partners across the United States. And the range is anything from prevention initiatives like childhood obesity or promoting smoke-free to clinical quality improvement efforts and promoting linkages between clinics and community organizations.
Recently on a national evaluation, we used a case study approach, so looking very deeply at a case by case, to understand what's going on for health and what outcomes really matter. For this work, our key question was, what are the outcomes of a health impact assessment? A health impact assessment is an evidence-based analysis, and it looks at the health risks and the health benefits for proposed project, plan, or policy before it occurs. So this work occurs mainly in transportation and the built environment, around things like a pedestrian master plan. How does that influence walkability in a community? We've been working in the field of health impact assessment, doing evaluation for about 4 years now. This first project, the national evaluation, funded by the Robert Wood Johnson Foundation, was a 3-year project. And through that work, we really uncovered key levers to make health impact assessments more effective and some unanswered questions, specifically around community engagement in these HIAs, health impact assessments.
The Healthy Dose Toolkit is a new and innovative way to describe population dose to help measure it and improve it. Population dose is a concept that grew out of the need to describe the collective impact of multiple strategies that are targeting the same outcome. We've been using it for obesity prevention work, and the idea is it's not enough to just understand the reach of a set of strategies, but we really need to understand the reach and the strength. How much of an impact are they having? A great example of community-based healthy eating programs would be a community garden where people are coming together to create gardens, to work together as a community to grow produce. Perhaps they're donating the produce to food banks and helping others in their community. It's a great way to improve healthy eating, to have education, and also to just have social networking and bring people together.
So the key challenge that we face in doing any of this work is that there's limited funding to do this kind of work. There's short-term investments to address long-term problems, and there's really high expectations about what you can do in the short term, which is usually not realistic. But there's a lot of opportunities that are really positive and promoting efforts that can have more of an impact on community health. You need to have collaborative approaches to addressing complex community problems, increased intersection and collaboration between the healthcare system and more traditional public health organizations, and the shift from more traditional programming to looking at policy systems and environmental changes that can have a large-scale community impact.
There are actually some great opportunities for the kind of work that we've been doing historically. And one is that over time, public health is becoming closer and closer to clinical medicine in both their thinking and approach. And so clinical medicine is becoming more population-based, and public health is starting to see the value of linking to the clinical sector.
The health impact assessment work is really about developing healthier policies, and that's connected to a broader piece of work called Health in All Policies that's really occurring across the country. We partner with folks to understand how they're merging and synchronizing multiple initiatives to make healthier policies. And this kind of work has a possibility for real change in health, and that's why we're at the table. It's the kind of work that we do.